Good morning, everyone. Can you guys hear me? All right. Thank you very much for joining us on this Friday morning. Welcome to the Friday morning internal medicine academic meeting. So we've got an exciting talk set up for this morning. One of our big drives for an academic institute is to get research. And there are several pitfalls to getting research done. Other than just the quality of the research, one of the biggest problems is making sure that the research is ethically correct. And for most of you who've attempted to do research or are busy in the process of doing research, you understand the process of submitting to our ethics committees. So we have two ethics committees on our platform. We have the Human Wits Ethics Committee, and then we have our local CMJAH Ethics Committee, and each hospital now has a local ethics committee. So for those of us who intend to do any research at the various sites, we need to get our protocols aligned to what the ethics committees want, so that there's no delay in getting our research off the ground. The most frustrating thing for our ethics committees is to submit protocols that are not aligned to what they're looking for, and then they return it back to us, and then it's a to and fro communication that acts as a significant delay and hindrance to research. And in view of this, we've invited two honored and esteemed guests. We've got Prof. Kemi and Prof. Palesa Motshabi, one from Wits Human Ethics and the other one from CMJAH Ethics. And I'm going to invite Prof. Palesa to first come up onto the podium, and she'll speak to us and she'll address the process of getting ethics through the CMJAH committee. And then after that, we'll go through the Wits committee. Okay, Palesa, thank you very much. Over to you.
Thank you so much, Ismail. Good morning, everyone. My apologies, I'm like in between places. After COVID, I've realized how much time just walking takes and traveling. I think you can go from one meeting to the other on Zoom, but walking is its own thing. It adds to your long day. Anyway, I'm just going to go through the CMJ and cluster research application process. And with cluster, we mean the cluster around CMJ, which includes Helen Joseph, Rahima Musa. Even though at this point, Rahima Musa and Helen Joseph are putting together their own research processes and they have a research committee on site. However, there are times where you want to conduct research in multiple hospitals, and you can apply to us and we can share that or details of who you can contact in the two hospitals or the smaller hospitals so that you can get that going through quickly. I guess I'm using this computer and I just have to press this. So I am Palesa Motshabi from anesthesiology. And at this point, I am the chairperson of the CMJ and Cluster Research Committee. So what type of research do we process? So we basically process all research that is applied for to be done at CMJ. And even though I have mentioned research for degree purposes, sometimes what we deal with is not just medical research. We also deal with structural research. You know, people who want to look at the structure of CMJ and look at how it was built and whatnot. Those things we also deal with. Sometimes we don't know how to deal with them because we don't understand the language. But we basically look at research for degree purposes. We look at investigator-initiated research, which is not aligned to a degree or anything like that. We also look at clinical trials from the clinical trial groups and multinational and multi-site research. So all of that goes through the same committee. And, you know, there's been talk and thoughts in the committee of how we can separate these processes because each one of them has a weight that's not similar to the other. For example, research that is related to case reports and case series doesn't need so much as research that is for a PhD or a master's or even clinical trials. The requirements for you to be allowed to do research in the hospital is not necessarily the same. So we are in talks in the committee to see if, you know, the smaller projects that need less cannot be processed by a separate group that can then have a shorter turnaround time. However, I will speak to you as I go through the talk of what it is that we've put in place in the research committee, with the view to really shorten the turnaround time of your applications. We are very cognizant, especially of MMeds, that everything is very time limited and you have to go through the process, including other things and your exams. So this is just I don't know if you can see, I thought I should particularly put this here because you should be able to recognize somebody from your department in this list of people who are in the research committee who are assessing research. And as you see here, there are months. So if you really want to target somebody in your department, you can look at a month they are assessing. Maybe they won't get your application. But so this group here assesses research in January and in June, because there's a lot of work and all of us are really doing this on a voluntary basis because we have other duties that we do. So, and then you have a group 2 here that assesses research in February and August, and this group that does that in March and September, so that we can give people a little bit of a break. And we have this group that does April and October, May and November, and June and December. And truly, if you go through these lists, you will find somebody in your department. And we encourage that each department be represented, because at least there's a person that you can go and ask if you're lost in the process and you don't know who to speak to because something has not gone right. So, and we are encouraging more people to join, particularly young consultants who have qualified, to serve on the committee, because the more people are there on the committee, the less work it is for all of the other clinicians who are doing other work during the day. So an invitation is out. You can email me if you're interested, or you can speak to Prof. Adam Mohammed if you're interested, and we can add you onto the group. The more people are there, the better, particularly for departments as big as internal medicine. So what do we do in the committee? So we basically, as I said, we assess all research that's presented to the hospital for as applications. What used to happen before is that applicants used to apply for research and take papers to the CEO's office. The problem with that we found was that documents got lost in the process. So basically, when you apply and you send a letter to the CEO, or you send your package to the CEO and you leave it there, it needs to be assessed by somebody. Secondly, then it has to be signed off by the clinical director. That's a different office. And once it's signed off by the clinical director, particularly all other research excluding clinical trials, it has to be signed off by the clinical director, and then only it's signed by the CEO. So there's a couple of processes, that vetting processes that your application goes through. So it's very important when you apply that your application has everything that it needs to have, because if it doesn't, it could come back in one of the processes. If it goes through all the way to the CEO's office as a rejection, it's a couple of days and a couple of weeks that it comes back to you. And now you're expected to give that one document that you may have missed by mistake, and then you go over that process again. So it's very important that you understand what it is that you need to put in, particularly speaking to the MMed applicants, what you need to put in your application so that your application can go through very smoothly. So the committee used to meet twice a month at 7 o'clock in the morning on a Monday, and we would go through the business of the committee and see whether the processes are going through, and basically checking on each other. And there are other matters that we discuss in the committee. The committee is also quite interested in research progress in the hospital. So we excuse me, we would like to encourage research in the hospital, not only, my apologies. The committee is quite interested in research being done in the hospital. Outside of only clinician research, we're quite interested in all of the health workers doing research, and we try to encourage that. So out of the committee, last year at least, there was a research symposium just for the hospital, where we put that together to showcase that research that's being done in the hospital. And that included research from anybody, doctors, nurses, therapeutics, because sometimes when we sit together, there's a sense that research is only for doctors, but there's so many other people. And particularly during this research symposium, one was surprised to discover how many nurses are doing PhDs, and some of them have actually completed their PhDs. So you may be sitting with an aspiring researcher in your ward and you don't know. So we're trying to be very inclusive, to invite everybody to change the culture of research in the hospital. One other thing that we did is we did a PhD symposium just to go over what is necessary for a person to put PhDs together. And out of that, there has been people who've actually started their PhD journeys. There is going to be a research symposium now called the Research Day, CMJAH Research Day, which is coming later on in the year and is led by Dr. Motshabi. I'm sure all of the notifications will go through, and we encourage everybody to be involved. If you're doing research at CMJAH, please be involved, bring your research forth. Let's see what you're doing. This also creates a platform for collaboration, because a lot of us work in silos and you don't know what other people are doing that's related to the work that you're doing. So if we're putting it out there, you're able to see who is in the hospital who's doing research that's similar to yours that you can collaborate with. So at the moment, the committee meets once a month. And again, we send out an invitation to all health workers and an invitation for people to serve on the committee. So the application process. So when you apply to do research in the hospital, if it's for degree purposes, those 4 things are what is necessary. And I've put in HREC application, and I'll explain that, and I'm sure Prof. Penny will also go over it. We've had lots of discussions about which comes first, the hospital research or the HREC application. However, you're able to actually apply for both processes if you really want your things to go faster. Importantly, what I didn't put in with ethics application and also with CMJAH research application that I should have put in writing, because one tends to think that it's something that's understood by everybody. HOD approval. If you're going to do research in internal medicine, you need to have approval from the clinical head of internal medicine to do research from the department. If it's a division, the division head should also give a permission for you to do research in their division. This argument came quite a lot because, during COVID, while people were knee deep in looking after patients in COVID, there were people who were hovering around just taking data. And that was not pleasant. And that, including that you cannot, as a head of department, see somebody walk into your department, walk out with data, and you have no understanding or knowledge of how that happened. So it's mandatory that you have approval from either the head of division or head of department, so that they know what you're doing. And also it's important when you have a head of division and head of department, not just to get permission from head of department, overarching the head of division who's actually working in the area and doing the work in that area, and get a permission from higher up. So please, we need to respect process and inform people. And we encourage that if you're outside of the department, try and get somebody to collaborate with in the department. If we do that and we're very collegial about how we do research, a lot of things can be avoided. So if you're doing it for research purposes, for degree purposes, postgrad approval is important. And you need to have NHRD application. And we say application because the NHRD process goes for a long time. So if you've applied on the NHRD website and you've got a number, that's all we need for you to get approval to do research, because we understand that it could be a year before they come back to you. But you have to have applied to NHRD, and the number starts with a GP and then you get a number behind the GP. So you have to have that. And then you have to have applied to the CMJAH Research Committee. Applications do not go to the CEO anymore. If you send it to the CEO, she sends it to me in the middle of the night. So please don't write to the CEO. rather write to me through the portal. The CEO just sends the emails back to me because she is not dealing with any research applications. Those letters, that's dear CEO, my application to do this, and her name at the bottom and a line for her to sign. She will not do anything. And then you will not have fulfilled the process, because during the application process, you actually have to be depositing certain documents into the portal so that they can be received by us on the other end. So again, and particularly as registrars and medical officers and students rotate, this information fizzles out. So please just pass it on to the new people so that they know that you do not apply to the CEO, you're just making more work for me on a Sunday to try and remember how many things went to the CEO that I must pick up and email back and say apply through the portal. So if you're doing research that's not for degree purposes, you don't need to have a postgrad approval, obviously. And if you're doing a clinical trial, you need to have registered the clinical trial into any one of the clinical trial registries and have a clinical trial registration number. And if you're doing something with a new drug or new process or anything that's not registered in South Africa, you need to have had SAPRA approval. I don't know if this is clear, and we can talk about this a bit later. So if you're applying for research in the department, and I'll see if we can't distribute this through the HODs, this is what you use to apply for research in the hospital. Okay, so, oh gosh, is it dead? Oh. If you see here, it says first link. This is where you just put your details. And if you see here, that's a link where you're going to upload your documents. This is what we're using at the moment. If you're not able to get a letter like this, you can use this QR code to actually go into the application. The application process is now online, it's digital, and you go through the links, and then, or you use the QR code to get into the links to be able to first put your details and then upload your documents. And when you open this link, there is a note that if you're not able to upload your documents, you'll get email addresses where you can then send your documents. So once you've done this and you've gone through the portal, which is something that this current research committee did because we're trying to circumvent the documents going between offices and everywhere, so that it's things that we can trace. So we decided last year to change the process into a digital process so that, there's tracing of things. However, we still realize that this is not interactive, and I'll talk to that a little bit later, but as far as we are now, this is how you apply for research in the hospital. I know it doesn't show much, but this is a letter that you will get when you apply for research and you're asking anybody, because on that letter, then you'll get the links or the QR code. So after you've applied on the portal, you actually, on the other side of the portal, this is what is put together. And perhaps this doesn't show so much, but what you're finding here is that already the document that's being produced on the other side is ticking what documents you have submitted. So if you've submitted a letter from the HOD postgrad, it says provided. And what you haven't submitted will say on the document pending. Although we get this document as the committee, and as you can see here, my apologies, this is not showing quite well. So you can see here, if you have an HREC application number, you have to put it here so that we know that you've applied to HREC. If it's approved, you also have to say that it's approved, yes or no. If it's conditional, you must say whether it's conditionally approved or whether it's unconditionally approved. But the number must go there, the NHRD number must go there. If you're doing a trial, you have to say yes or no, and there will be a trial registry number there, and then you can put details. In fact, you don't, as you put them on the interface that you have, this document is produced. So this goes to the assessors. with all of the documents that you have. So when an assessor receives your application, they receive this and they go then into your documents to verify what's in there. Look at the your application, if it's for an MEd, to see that it was approved by the postgrad in your department. Importantly, you have to always also have your data collection sheet, because this is where the interest of the hospital is, in that we want to, there's multiple processes. Obviously, HREC also does the same thing, and we hope that your postgrad in each department does the same thing. But we're also looking at whether the research that you're going to do is not going to financially disadvantage the hospital. You're not going to do things that are not in the SOP of how you work, and suddenly there's like millions of money that the hospital has to spend because you want to do this novel research. So this is the letter then that gets generated out of that application process, and then it's sent as a package to the researchers, to the assessors, with this letter with all of the documents that you've submitted. So once the whole process is done and your application has been processed by the research committee, then it gets sent to the clinical director. As you can see here, Dr. Punwase has to sign first, and then it goes to the CEO. So it's a system of checks and balances, just to make sure that things just don't go through and we have an aha moment and things haven't been done properly. So once once we've put together that document that you just saw now, it has to be signed by somebody who assessed the research. And I wanted to actually make you aware somewhere. When we receive the research, you can see here, date received. It even gives the time and date of when you completed that application and the document was put together. So then it gets signed by the CEO, and then it's either approved or not approved, or conditionally or unconditionally approved. If it's conditionally approved, you can see in this particular one, there are notes there that came through the process to say, this is missing, please provide this before we can give you full approval. So you will get a letter like this that comes from the CEO. The CEO signs it at the end, but there's these systems of checks and balances to make sure that the whole thing is appropriate for research to be done in the hospital. So because we have that process that we have, which is in a portal that uses Microsoft, basically, we are embarking on a process of trying to get an interactive portal where you will get report back if your stuff is not complete, if there's a response that you need to see, that you need to respond to at a particular time. So the portal at this point is still in development, but it's actually complete on the inside, but we're working on changing the name. As things stand, it looks like this because we actually cloned the Wits ethics portal. I don't know if any of you have used the Wits ethics portal. You register, you will have your own details registered on there, and it's interactive. So basically, when you go onto the Wits ethics portal, it looks a lot like this inside. So you can, you'll have your drafts, you can follow your application, track it, and your certificates can be put on there. You'll have your profile, and you can put things in at a scheduled time if you have to put them in. So the new portal is going to look like this. It's going to be interactive. It has been built, but because we cloned the Wits health ethics portal, the problem we're dealing with now is actually making sure that there's no confusion and that we can change the name here to reflect CMJ and cluster research. It's a thing. I don't know where the problem is, but I leave it to the IT people. And I want to say and acknowledge the Wits Health Consortium that has really come to the table to assist us in making research applications and research processing at CMJ kind of like a world-class thing, because they are actually helping us with this new interactive portal without any fees. And so we're waiting on them to actually help us with whether we can change that name so that it reflects this and there's no confusion, because you might be applying here and thinking that you're applying on ethics. So we haven't rolled it out yet, even though it's built, it's there. We're just dealing with a few nitty-gritties to clean it up and be able to roll it out. And we're hoping that we can then put it online on the Gauteng Health website, because we have explored whether we can put it on the CMJ website. It looks like CMJ's website is not run by CMJ, so we have to go through province to load this up, and also put it as a link on the NHRD application, so that when you apply on the NHRD, you can actually go onto the CMJ research link and finalize your application on that. So it's a process. So this is the new interface that you will be seeing on the side once you've uploaded your details. Again, we're going to have a CMJ Research Day, and I think details will come through. I know that colleagues have formed a committee and they're busy working on it. It's going to be later on in the year, and we will pass that information around and make sure that everybody knows about it and they can participate in it. So again, the Wits Health Consortium has also been really helpful in that they've assisted us with acquiring an administrator who just deals with CMJ and cluster research after trying other models and asking for secretaries from everywhere. Now we have an administrator who is employed only to deal with CMJ and cluster research, and that's her office number. I don't know why I did not put her email address, but I will send it out. And the people that you can email also if you're having problems are myself, Mr. Musiamo in physiotherapy, who's the secretary of the committee, and Professor Luvengo, who deals a lot with the administration. So you can email us. I apologize. I will send out the email address for Deboho so that if you're having problems, you can email her. She sits in my office up in medical school, and you can walk up there and just speak to her. She's quite responsive, because even when you apply, she's able to pick up what you don't have, and she'll email you immediately and say, this is missing, this is missing, this is missing. And then, your application can be dealt with within a shorter time. Our turnaround time is aimed to be 10 to 14 days. We've had glitches, but we're trying to tighten the process now that we've got a secretary or an administrator that's dealing purely with research in the department. And we're really grateful for the Wits Health Consortium for funding this. So yeah, in a nutshell, that's us. I don't know if you have any questions. I don't have any anything to say. I'm just an administrator.
Thank you, Prof, for the talk. There was one question from the chat. This talks a lot, obviously, with research over a long time. What about case reports? Because those should typically have a quicker turnaround time. And sometimes we've been having challenges where waiting 3-6 months for case reports, and by the time we get approval, other people have published similar case reports. And it's a quicker way, I guess, for junior doctors, especially, to get publications and their name out there. So is there going to be a different stream for case reports versus?
Yeah. So as I said earlier, yes, we're looking at having different streams so that, things that don't need a lot can be assessed by a smaller group of people and they can go through quickly. At this point, they're being assessed by the committee that's assessing that month. But if a case report, I think it's the way people present the case report as well. A person says, I want to do this, and they write a letter to the CEO. You have no idea what data they want to use. And they also still need to get clearance from HREC because they're going to use human data. Yes. So you actually have to tell us what data you're going to collect. So that we're looking at the data and we say, okay, so you're going to, even if it's a patient that you've never seen and has a particularly novel diagnosis, the point is that you're going to take the age, you're going to take weight and whatnot, and some other X-ray and all those things. So we've got to know as the assessors what data you're going to look at. So we always send an email out back to the application or the applicant to say, please tell us the data you're going to use, because you also still need to get HREC approval, even if you're doing a case report or a case series. As long as you're dealing with human data, you have to get clearance for that.
The human resources does case reports on more ad hoc basis. So
Yes.
it's not where it goes for the pro.
Yes.
Whether it is at monthly
Yes.
meeting, if you submit a case report, it's done
Yes.
in a bit of a shorter
So
time
we are
basis.
looking at that as well. Yeah, we are looking at that. So we're trying to work through processes. I'm sure when all of the processes are in place, I will step down and somebody else can take.
Palesa, can I just ask?
Yeah.
Are we not duplicating our efforts by going through two separate committees through such extensive regulatory, pitfalls or checkpoints? Would it not be more streamlined for us to combine what your committee is doing with HREC and just add that to our HREC application at the bottom in some way and ratify it with one committee?
Yeah, even if there's, I was thinking earlier.
Because I can't see, I'm just looking at the dynamics. I mean, other than those application numbers that need to be going through, if those application numbers can be then included into our Wits HREC application form, and then from Wits HREC sent to a subcommittee from you, say it's gone through Wits ethics, can we then look at it, in terms of the hospital? I just find it that going through it into separate processes might just delay unless you go,
So usually if you've had HREC application and you come with a conditional approval, because HREC will not give you unconditional approval if you haven't gotten
Yes.
the hospital research committee. If you come with a conditional approval, the process is quite quick, because the person who's looking at it can see that you've gone through HREC. That is why in the beginning I said you are able to actually apply through both processes, or you can apply through ethics and get conditional approval. But then we know that things have been looked at, and also through the ethics process, you have been put through all of those things that you need. And it's not a new application where you're just sending a letter and you don't know whether you must send this. So if you've gone through HREC, it's quicker for us to actually approve your stuff.
So would you then advise us to first go through HREC, get HREC conditional approval? I'm just trying to speak to the audience and trying to get a bit of
where the catch is if HREC says we're not happy with 1, 2, 3 from their side, and they say you must bring corrections first, and it's major things, because then we hamstrung. We all we can say is we're giving you conditional until you have sorted out the issues with HREC. Do you understand?
So what I'm asking is that if we get conditional approval from HREC, so I'm just trying to think in my mind, how can we advise our platform in terms of streamlining the application? So if we get conditional approval pending CMJAH approval,
it's quicker.
Then
It's much
should we
quicker.
then start? Should the MMeds and MSCs and PhDs start with HREC first? Sort out everything in HREC, make sure everything in HREC is ticked and crossed.
And HREC is saying we just want the
Only
hospital.
one hospital, and then we bring it to you.
Yeah, then it's quicker.
Is that
It's
quicker?
much quicker. And a lot of the times as the chairperson of the committee, because I get to see every single application, when it gets sent to the groups, I get copied on everything. So I'm also able to pick out, applications that are quick. I've been able to pick out applications that come out with all the approvals from everywhere else. And I assess that. I can assess that within 20 minutes and try and help the process, and then, get those out of the way. So if the processes have been gotten through, it's easier. And I'm sure as a committee, as I was saying, that we're looking at streamlining. We've had a lot of issues with administration, and our secretary or the administrator has only started mid-January and started in the middle of no administrator, because the administrator we had borrowed had been taken back. So we literally had for 2 to 3 weeks nothing. And, you know, now she's being put through the processes, and there's a process of the change of the portal. But, you know, once things are stabilized, we'll have smaller groups that do this and do that. How we divide that is a point of discussion, because, you know, in the meetings we sit and we discuss where are we going, what are we doing, how can we do it better? And all we're trying to do is make the process as easy as possible. But I want people to understand that the whole thing about the research committee is something that is a requirement by the province. The province has put out a requirement that each hospital, even the level 1 hospitals, they have a committee. So a requirement by the province is that each tertiary hospital must have a research committee. And there are other hospitals that I'm aware of that have not gotten to have a committee. They have one person who just signs. If you have an HOD letter, they sign it. What it's entailed in it, it doesn't matter. And as such, for me as a person, I feel as head of anesthesia, I can approve a research project that can eat up the resources of the hospital. It's only fair that it be put through a process where an independent person can look at it and say, but how are you going to be doing, you know, pro-BNPs and CT and TNTs on each and every patient that comes through for a knee replacement? You understand? So somebody else should be able to look at it and say, but there's something not right here. And that's where, for me personally, I feel the importance of the committee, the independence of the assessors. We have to be accountable to each other and to the hospital as such. So if there's a process where I'm only looking at a certain group of things, I can just, you know, if I agree with you, I can just be signing off your stuff. So I sleep better knowing that I don't have to deal with issues of corruption. There's corruption everywhere in South Africa now. Somebody else is doing it independently. Their decision is independent. I can assist if there's an administration problem. I think I just try and divorce myself from being too involved with things that could create conflict.
Sure. Just one comment from Prof in the comments. He says one concern, maybe this leads to how you said we get separate streams, is clinical trials or competitive recruitment. Sometimes
Yes.
there's a delay in approval from hospitals, so end up losing out.
No, I absolutely understand where Prof is coming from, and this is why Prof and the group have assisted us with an administrator, because the biggest problem is that I could not follow up all the emails. So we are tightening the process, and I know that the clinical trials, from particularly anything that comes from Wits Health Consortium, they have groups that do them. So they come with all the requirements. But without an administrator, nobody even knows that you've applied. So the things are getting a lot better. Within the first 4 weeks, we've seen that, you know, a person is contacted if there's a problem. So without, you know, letting the cat out of whatever, just as we got the new administrator and applications were done within the first week, the director's secretary was on leave. So that was a gridlock. So those are the things that we've got to, you know, get over, because even though there were secretaries in the director's office, none of them knew what to do. So it's processes. We have to really get on top of the processes. And, you know, the committee then does its work, and it seems to be getting much better. But if we have problems upstream, that also doesn't help. And we're trying to address that.
So one more question, if I may ask this. For those of our students who are having a bit of a delay, got ethics conditional, pending CMJAH authorization, and for some reason or the other, the application is now delayed somewhere along the line. How can they now fast track? Should they reapply? Should they come see your administrator? What's the way forward?
They can contact the administrator. The problem is going to be things that were done, but we still have contact with Lindu, who we had borrowed from nuclear medicine. So it's going back into the, you know, we had so many changes with secretaries that the one day the secretary is gone, and now you don't know where you're trying to look back. So we need stability in that area where a person can look back and see where your application had gotten stuck. I would suggest that they call Tebogo and give her the details and email. I'll give you her email address. They must email Tebogo and give her the details, and she'll look back and contact Lindy as well and try and see where the problem was. If we really cannot trace things, and this is the problem, we need to be able to trace our things. Then what we can do is say to the applicant, send the application and I'll sit and do it. I usually sit and you know, try and sort out the issues. And if this application has been lying around and nobody knows what's going on, I sit and I assess it and then I send it through. Yeah.
So
Unfortunately, it takes up a lot of my time.
So maybe you can just simply with details and then I'll put it up on the chat.
Okay.
Because you don't log in,
Okay, I'll give it to you. I'll send it to you.
Just for some of our colleagues,
Yeah.
who stuff, they don't
Yeah,
know.
and she's really she's quite astute. She will email you. There's I've seen a change because I am copied all the time. And I would like to invite you to take over when I step down. I'm done. Or anybody who feels the strength to do this job.
Thank you very much.
Thank you so much.
We really
Thank you.
appreciate your time. We know how pressure it is. And thank you for offering us the guidance on the way forward. So for those of our colleagues who are in the process of submitting or who have submitted already but have got some hurdles with regards to their submissions, please, Professor Motshabi has given us clear indications as to what needs to be on our application, number one, the reasons for the delays. So if we're not doing our part correctly, then we cannot blame anyone else, right? So go back to your application, see what information is missing, see that you've got NDRD, see that you've got SAPRA if you need SAPRA, see that you've got HREC. If you've got those numbers, then as Professor Motshabi said, it shouldn't be any further delay. You should be able to get it through quite quickly, right? So I think from our side, and Prof Penny will give us a bit of indication about HREC, which is another significant hurdle that we need to go through. My advice would be to start with HREC first, because that's your filtering system. That's a very intense scrutiny of the project that you're going to be submitting through. And then the rest of it will become more regulatory with regards to Wits ethics. All right.
Right, morning everyone. Thanks for this opportunity, Prof. Kalla. So I'm going to talk to you from the Human Research Ethics Committee's point of view. I'm quite hopeful having listened to Prof. Motshabi's talk, it seems that our forms look very or may become very similar. And I think that will help the processes if they are actually the same kind of form. At the moment, so the online system is still under development. The idea is that it is going to be an interactive process so that you can check on the progress of your application, but it's still not, all the functionality is not as yet quite activated. So, but it is happening. So I'll talk to you about procedures and principles of ethics from the HREC medical's point of view. So what is ethics, just briefly? So it comes from the Greek word ethos or character, which is the systematic study of value concepts, so good and bad, right and wrong, and the general principles that justify applying these concepts. I'll come back to ethics shortly, but just briefly a little bit about ethics at Wits. It is actually, we are the oldest committee in the Southern Hemisphere, established in 1966. Just some important happenings with regard to our ethics committee. We were audited by the Office for Human Research Protections, which is an American ethics organization. And this is a particularly important point to note because we are recognized by OHRP, this qualifies us for US federal funding. So money from the NIH and various US federal bodies. Without this recognition and without a functioning independent ethics committee, we would not qualify for this funding or possibly other international funding. We are audited. I'll speak about this just now, but we're due for an audit this year by the National Health Research Ethics Council. So just briefly, just some points. Where do we fit in within the university infrastructure and in relation to ethics within the country? We actually fall under the National Health Research Ethics Council, and we report directly. We are a regulatory body which follows the legal requirements as required nationally for research and for ethics around research, human research in South Africa. We nominally report to Professor Lynn Morris, who's the Deputy Vice Chancellor for Research. And of course, we interact with the faculty, the researchers, clinical trials, trialists, and sponsors. So of course, we have a huge responsibility to you, the researchers, and to the faculty. I mentioned we have to report annually to the NHREC. So we write or submit an annual report telling them about our activities every year. And then every 5 years, they audit us for compliance. So they want to know how we are operating, what are we working within the realms of South African health law, are we following the requirements of our South African Constitution in terms of ethics and research. Back to university policy. So all research conducted by Wits staff and registered students or visitors doing research on Wits premises has to be scrutinized by one or more of our recognized ethics committees or biosafety committees, and you have to obtain a final approved clearance certificate before you start your research study. And there are no exceptions to this principle. And sometimes it happens that people do start their research without their clearance. And unfortunately, we cannot issue a certificate, ethics clearance certificate retrospectively. And that person would have to destroy their data and start all over again, because you may not use that data. It was not legally allowed for that person to proceed with their research. So why ethics review? I've hinted at that in the first slide. So we promote guiding principles and the conduct of an individual or a group. So we promote norms in research. And this includes a number of important moral and social values. These relate to human rights, social responsibility, animal welfare, where people are working with animals, compliance with South African law, and public health and safety. And also just remember, it involves protection of human information, because you are going to be working with human information, clinical information, personal information. And of course, we now also have to comply with the POPI Act, where we have to protect, we have to undertake, as we have always been doing with ethics, to protect personal information. Some key principles. I'll just highlight the Belmont report, first published in 1974. 4 key points were published. The first is non-maleficence, so do no harm. Secondly, beneficence, so do good. I'm not going to go through this in detail. Thirdly, respect for autonomy, so respect the decision-making capacities of people that you're working with, and you need to enable your participants to make reason-informed choices. And fourthly, justice, so you need a fair balance and distribution of risks and rewards, so be fair. Some other principles that we adhere to, published by the World Medical Association, the Declaration of Helsinki, the current version that we refer to is 2013. These are ethical principles for medical research involving human subjects. The HPCSA has a guideline on ethics in research, and the DOH 2015, Ethics in Health Research, and also the Singapore Statement on Research Integrity, which I think comes up shortly. This is on the Wits research webpage. Similar to the Belmont report, honesty in all aspects of research, accountability, courtesy and fairness, good stewardship of research on behalf of others. So in terms of the ethical review and approval, RECs, or in America, institutional review boards, independent review boards, these are independent bodies which consist of healthcare professionals and non-medical members. So we have a range of members who participate, who take part in these meetings, and whose responsibility is a very important one to protect the rights, the safety and well-being of human subjects. And this process of independent review, that is a critical aspect of an ethics committee. It is an independent committee, it is an independent review. This is mandated by our health legislation for research with human subjects. So RECs review studies right at their inception. We look at the science, we assess the risk-benefit ratio, we look at the informed consent. So is there informed consent? And we monitor the studies as they proceed. So this is done by continuing reviews, so especially with clinical trials. Amendments, we review amendments, so you might want to submit an amendment and we will review that and say, yes, this is okay, you can go ahead. Adverse events, so especially with clinical trials and any unanticipated problems. So ethics review, yes, there is an initial review process, but at times it is an ongoing process if you have an extended study. Of course, you can imagine that ethical lapses in research could significantly harm people, participants, animal subjects, students, the public. So you can understand why the ethics committee is so important, why we try to assess the risks and benefits of a study. We do not want participants to be harmed. We do not want you, the researchers, to be harmed. So potentially the researcher could place themselves in a tricky or dangerous situation when undertaking their research. So this is all part of the ethics review process. In terms of the composition of the Wits HREC Medical, I've mentioned these comprise active researchers within the organization, so staff from within internal medicine, for example, and people from outside the institution. So we might have ethicists, lawyers, social workers, lay people, religious people. And importantly, we have a secretariat. So these people are very important and they are potentially very helpful towards you, the applicants. And all of us have signed confidentiality agreements. We may only discuss the study within the committee and with you, the applicants. Just briefly, you can see the range of people on the committee. I'm not going to go through this. It's a very broad committee. And this is important because everybody has a different field or scope of experience, and we all contribute with our knowledge to the review of the protocols. Now, as Palesa mentioned, their application is online like ours. It is online. The full ethics application is submitted online through that Wits portal. This is the link here. Perhaps we can make some of these slides available so that you can easily access this information. Now, how does this work? The application, as I said, is online. The closing date is the 7th of every month. Usually it's the first Friday of the month. So that's your deadline, by which time you need to have uploaded all your application form and all of your documents that support your application. Each application is then delegated to 2 reviewers. So we'll try and match your application to people in that area of expertise. So if you have an application in, say, some kind of renal research, we'll try and match that or submit it to people who are involved with renal work, nephrology. I'll talk about other applications shortly, record reviews, secondary data analyses, and so on. All of the members receive all of the applications, and we may comment on any of those applications. Sometimes we might need to interview the applicant. Sometimes we might say, you know, we don't really understand what you're getting at. Could you come and chat to us? Sometimes it might involve a subcommittee. Sometimes it's just 2 or 3 people. Decision is reached. This is usually by consensus, very occasionally by vote. I don't think we've ever seen a vote. I haven't seen a vote on our committee. Perhaps Prof. Feldman has. There is an appeal procedure. So if you think we've been very, very unfair, you know, we really haven't listened to you, there is an appeal procedure. If you sort of followed all the routes through the university, you can appeal to the National Health Research Ethics Council. So there's an application process where you can submit your appeal for them to consider your case. The other thing is just bear in mind that anyone may report any wrongdoing to the National Health Research Ethics Council. So you may act as a whistleblower and report some unethical research that you might be aware of in a clinic or in a hospital somewhere. Often it comes first to myself, and we then engage with that person and try and investigate what is going on. Again, these are just the steps to download additional research ethics documents, and there are some of those which you require. I'll come to those shortly. You can also, I don't know if you do use the Wits website, there's Kudubot, and you can ask Kudubot some questions, some very basic questions, as to say, where's this, where's the ethics form, and Kudubot will tell you where it is. So it's an interactive app on the Wits website. So now, I'd like you to remember that your application form is actually a legal document. And ethics clearance itself is a legal requirement for human research in terms of our National Health Act number 61 of 2003. It is also Wits University requirement. And as I mentioned, you have to obtain ethics before starting a study. Also, and as I mentioned, we cannot issue a certificate, an ethics certificate retrospectively. It is actually against the law. You may not do it. Also by law in South Africa, written informed consent is required. In other countries, for example, in North America, verbal consent is acceptable, but it is not acceptable in South Africa. And you, the applicant, you are the legally responsible person. It is not the funder. It is not the Wits department or division. You are the responsible person. And with your ethics clearance, you are legally covered by the university. You are indemnified by the university once you have your ethics clearance certificate. The good thing about the Wits ethics certificate is that it is valid for 5 years. And you may renew it after the 5-year period, and this requires a progress report and a motivation. Just more or less a look at the form. We do have an example of an information sheet on our website. I'm not going to go, we don't have a lot of time today. I'll just briefly mention informed consent. Remember, it has to be written informed consent. It is required by everybody who participates in research or clinical trials. So you have to provide an information sheet for the potential participant, explaining very clearly, very simply what the study is about. And this process is really important to the ethical undertaking of all biomedical research. And it is encapsulated in global human research guidelines and regulations, stemming from the Nuremberg Code of 1947 and the Declaration of Helsinki. Moving on now, what are the kinds of projects that you could be undertaking? So they might be prospective studies. So these are quite important, different, and are very time dependent. So just think about it. If you have a prospective study which requires consent, you have to have the time to identify your potential patient group or participants. You have to have the time to meet with them, to explain the study, and to obtain their consent. This takes time. Procedural audits, clinical procedural audits, these require consent. There's a whole category of studies that do not require written informed consent, and these include retrospective record reviews, secondary data analyses, self-administered questionnaires. So the mere process of you or myself completing a questionnaire indicates consent. So I don't need to give written consent. If I undertake to answer perhaps an online questionnaire, I've given my consent effectively by doing that. And systematic reviews, these are waivers. There's no informed consent. Those don't come to the ethics committee, they just come to the chair, and we issue a waiver certificate. And often when we are asked, well, why do we need a waiver? It's extra work for us. So you often need waivers for publishing. Journal editors want to know if your work has been scrutinized by somebody on the ethics committee, and also funders. So you won't obtain funding in this university, for example, from the faculty, without your waiver certificate. Also the MRC, Medical Research Council, would like to see a waiver, and other funding bodies. And journal editors, journals have become stricter these days. They really do want to know if your work has been reviewed by an ethics committee or not. Now, just going back to record reviews, clinical reviews of patient records. What do we mean by retrospective record reviews, and what do we mean by prospective record reviews? Remember, we said that retrospective reviews do not need consent. And if this is the date, this dotted line represents the date of the meeting, say, for example, today, our ethics meeting, the 24th of February, all records going backwards in time from today backwards are retrospective. You do not need consent for those. Any records going forward from today forwards in time are prospective. These are most likely, these would be patients these are active patients in your clinics. You need to obtain their consent to look at their records and in order to carry out research using those records. Just remember that in terms of the intent to do research, our SA Constitution Bill of Rights applies here, that everyone has the right to or not to be subjected to medical or scientific experiments without informed consent. And even if you have given your informed consent, you have a right to withdraw. You can withdraw from that study if you so wish. You don't have to give a particular reason, but you have the right to withdraw, and to withdraw your information and your samples. So just a little bit more on ethical requirements. So the guidance is needed to prevent exploitation of subjects or participants. We prefer the word participants in research, and the protection of personal information, because you're going to be working with personal information. And we use a systematic approach to determine whether a study is ethical or not. And we balance these principles in applying them to particular studies or trials. And it's often a complex process. So what we do is we look at the risk to the individual or the benefit to the and it's always the individual that dominates over society. A lot of the studies, of course, if you think about retrospective record reviews, these are low risk, these are minimal risk. You're not working with participants or patients. You're merely working with their information. But of course, you have to protect that information. If you think about COVID, so think about the COVID vaccine studies, that was high risk. That was risky for us, for clinicians, for the ethics committee. We didn't know what was going to happen. But there was the potential of great public benefit at the end of the day. So there are times at which we allow high-risk studies to proceed, and I'll talk about that a little bit down the line. So we evaluate the likelihood of harm. What is the size of the harm? How can we minimize the risks? So we could ask for additional tests, additional safety reporting, for example, as we did with COVID. We asked investigators to report to us every 2 weeks. We wanted to know what was happening, what were the adverse events every 2 weeks. So we only consider the benefits from research interventions and not the benefits from added health services or payments, which are not necessary to the research goals. And only if the potential benefits to the individual outweigh the risks, then you may only proceed. So we need to find that the risks to the subjects would be reasonable in relation to the anticipated benefits, if any, to the participants. There aren't often any benefits. And also we consider the importance of the knowledge that may reasonably be expected to result from the study. So just going back to the types briefly, the types of applications. So when do you need to make a full online application? So clearly for prospective clinical record reviews, laboratory studies, because these contain information that identify the patients and that is not in the public domain. One needs to list the inclusion and exclusion criteria. You possibly need to perform a sample size calculation. How are you going to collect the samples? What types of samples? Are they bloods, urine, saliva? How often? What are the sampling tools? Are you going to be carrying out interviews, questionnaires, and so on? So there's quite a lot to consider, and there's quite a lot to go through in the application form. You need to describe any intended medical intervention. You need to provide the patient information sheet to the potential participant, and you need to provide the consent form. So you do need a full online application for retrospective anonymized clinical record audits, but the retrospective applications do not go to the full committee for review. They go to a subcommittee, myself and some other people who review these before the main meeting, and they are then ratified at the meeting. Sometimes we discuss one or two applications that we might not have been clear to us, but they generally reviewed before the meeting, and given that you've provided all the information that's required, these applications can be approved on the day of the meeting, and one can actually obtain the ethics clearance the following week. So again, they do contain information that identifies patients, and this information is not in the public domain. Of course, where the information is in the public domain, so if you are accessing a public database for your research, that qualifies as a waiver. It does not require review by the full ethics committee. Of course, you need all your approvals. So with all of these studies, you need your hospital CEO, HOD, clinic manager, approvals, etc. I think something's out of sync. Secondary data analyses. This is a full online application. Again, contains information that could identify patients and it's not in the public domain. So you need to give us information, the details of the database you're using. We need the original ethics clearance. You need to provide a list of the data that you can be recording. We need the permission from the database gatekeeper allowing you access to that data. You need an ethics training certificate. So the National Health Research Ethics Council has asked or indicated that they would like everybody to have some form of ethics training. And we recommend this site, the TREE site, which is a free online site. It has various modules which take about an hour at a time to do. It's relatively quick and easy to get. Also with your applications, you need, if it is a postgraduate study, we need eventually your postgraduate approval letter. Now, there's a series of applications other applications which don't go to the full committee. And one of these is a sub-study. You do complete the full application form, but currently it is not online. It is a downloadable form similar to the online application form. So you complete this form and you send it, you email it to the Ethics Administration Office. And there's no time restriction. The review period takes about 10 days. And given that everything is there, you'll have your ethics clearance after about 10 days. Case reports, these are also for application. Again, these are submitted by email. There's no time restriction. Again, takes about 10 days. You need all the same information that you need for the full online applications. You might need consent from the patients. So the patient might still be somebody that you're seeing in the clinic. You might still be able to contact the patient. In those cases, we would like to see a written consent from the patients. Often the patients are lost to follow. You need to tell us that. By the way, we can't contact this patient, lost to follow. You need to provide a list of data, must be de-identified. Medical photos need to be de-identified. We need the proof of permission to do the study from the HOD and the hospital CEO and the research committee. We need your ethics training certificates. Waivers, I've spoken about briefly. So waiver from ethics approval may be granted in the case of a review of information in the public domain. So anyone can access that information. It doesn't require ethics approval. In vitro studies might be involving cell lines or bacterial isolates or viral isolates. Literature reviews, that's another waiver. So in the case of a waiver, you need a motivation letter signed by yourself and the head of department describing what you're going to do. As I mentioned earlier, the waiver certificate might be required by funding bodies like our Faculty Research Committee, the Medical Research Committee, National Institutes of Health, or by a journal editor. Again, you submit by email to the ethics administrators. There's no time restriction. Again, takes about 10 days to obtain the waiver. So here's a checklist of common documents that you need for your ethics application. So whether it's retrospective or prospective, you need a protocol, you need an information sheet if you are working with participants. You need a consent form. You need your data sheet. The data should be de-identified. You should not have any identifiers on the data sheet. If you do require to collect some identifiers, these need to be stored separately. So they need to be stored in a separate place on a separate hard drive and linked to your data sheet via a study note. You need a whole series of permission letters. your HOD or clinic manager. It might be a theatre manager, hospital CEO, that's the hospital research committee, the database gatekeeper. If you're working with NHLS information, you would probably need to register, you will need to register with ARMS in order to obtain permission to access data through the CDW, the Clinical Data, Central Data Warehouse. You need your ethics training certificates. So not only do you need the training certificate, your supervisors and any co-investigators also need to present or produce ethics training certificates. You only need to do one module. It's not too terrible. It takes about an hour, I promise you. And if you do fail it, you can repeat it. You need a 75% aggregate to pass. And also you'll need your postgraduate approval letter. You may submit, so we do try to encourage and try to facilitate the review process, so you can submit your application without the postgrad approval letter, and once you get that, you can send that to us. So once we've reviewed your applications, all the comments are minuted in the meeting, and those have to be checked, because remember, this is a legal process. All the minutes have to be checked by the administrator who runs the meeting. And once those have been verified, the comments will be sent out to you. This process takes about 3 weeks. So after the meeting, 3 weeks after the meeting, you should receive your comments. And the idea is that those comments will eventually be uploaded to the online system. So you can access the online system, download your comments, and respond to the comments. It's really important that you respond in good time. So if you take 3 or 4 months to respond to your comments, it's going to delay obtaining your ethics certificate. So please try to work quickly. It helps everybody. So just in closing, everyone is strongly encouraged to use the appropriate university ethics committee to screen your protocols involving human participants, their associated data, and human biological samples for research. So if you're not sure whether or not you need ethics clearance or have some queries, so you can consult the ethics administrators, or you can email myself or any of the co-chairs on the HREC committee. But we always say or advise, when in doubt, err on the side of caution. So don't start your work without your ethics clearance. Rather, do the work, get your application, and then start. Get your certificate, and then start your research. So ethics is knowing the difference between what you have a right to do and what is right to do. So just generally now, so we do see ourselves as facilitatory. We like to help. Don't be afraid to ask for advice from any one of us before you submit the application. There are a few names here, and there are a number of experienced people within internal medicine who have had, for example, Professor Feldman, who has long been associated with the ethics committee. And so thanks, that's it. I can take some questions now. Yes, at the back.
So I have 2 questions. So does a provisional approval give you the right to commence the work? That's the first thing.
Yeah.
And the second thing is, now that we just had a talk about the CMJAH research committee, is that committee approval letter similar to what the CEO does, or we need 2 letters exclusively?
Okay. So first question, so provisional clearance does not allow you to start your research. You still have to answer, there'll be queries that you have to answer or documents that you still need to supply. So for example, you might not yet have the HOD permission or the CEO permission. We call it CEO permission, which is the hospital research committee permission. So that is a separate document to the HREC clearance certificate. So don't confuse those two. So you have to have, by South African law, you need to have the ethics clearance certificate before you can start your research. And of course, the go-ahead from the hospital. So we do, I mean, it is kind of a duplication of review processes. So we also review, we also look at and assess whether studies are going to be accessing and using hospital resources. And we don't approve those kinds of studies. We question those. So there's a duplication of processes. And I think somehow we need to talk more with the hospital research committee in that sense. Just by the way, so the ethics committee is also highly regulated. We have to meet certain requirements by the National Health Research Ethics Council. We need a minimum number of 10 people on the committee in order to be, we need, registered, a minimum number of 10 registered members to be considered a correct ethics committee. And we have to reach quorum before we can start the day's proceedings, reviewing of or discussing the ethics, the applications on that day. So it is a regulated process, it is a legal process, and we do have to meet these requirements as regulated by the NHREC. So we're not just a group of friends who meet and sort of chat about your project. We are kind of, but we meet stringent requirements to do that.
So just for those colleagues, the members of the HREC committees meet on a Friday afternoon once a month. I've often seen Prof walk around with piles of applications that almost would fill his whole car. And we underestimate the amount of work that goes into an ethics application and the behind the scenes. And if we don't submit our applications, with all the necessary information, it makes their task much more difficult. And then they become frustrated, and they give us back letters that makes us frustrated. And the entire process then becomes extremely laborious to the point where some people actually abandon research. And that's not the focus of the process, right? So the appeal again, and this was the reason for the meeting, is for us to make sure, firstly, that all our documents that we submit are according to the guidelines that have been presented today. It's very easy for us to meet the guidelines that they've presented for us. So we need to read the rules and regulations for an ethics submission, try and make sure that we've crossed the T's and dotted the I's, and submit an application that will not delay the process, so that more time is spent on rather debating the validity, and for them to give us positive feedback about how we can improve the study, rather than focusing on technicalities about our informed consent, or technicalities about this number missing, or this paragraph being too long, or the PI not being appropriately in all the different pages, or signatures that are missing. And that's a waste of time for them and a waste of time for us. And these are highly qualified individuals who, for want of a better term, are doing this pro bono. And they've got better things to do, right? Honestly.
No, but it's a very rewarding process.
Yeah.
I enjoy it a lot. I think that's why we do it, because it's a challenge.
But I'm sure, as frustrating as it is for us to get back that letter to say, please attend to 1, 2, 3, 4, it's as frustrating for them to publish those letters, right? So we need to make sure that we are submitting from our department, ethics applications that are worthy of scrutinization for the validity of the study that we want to do, rather than for the language and the protocols that we sometimes, tend to overlook. And I think that we can all strive for, right? And secondly, Prof Motshabi has given us very clear guidelines as to how to get it through our local CMJAH ethics committee. I've shared the administrators' details on the chat, so please, for those of you who need it, download it, keep it, and let's use the context that we have. This particular talk will be is recorded, and the link will be provided. So please, for those of us who have been unable to attend or have attended a bit late, let's access the information that was presented. It's a fantastic meeting, and we should use the guidelines to get our, I think the first and the most important stumbling block to research, other than developing a research idea or topic, is getting it through ethics. And these are our guidelines to get it through as quickly as possible. Okay, thank you very much for everyone who has attended. I really appreciate it.
Happy to meet small groups.